got something on your hand,
That's
too.
right. I had a trigger finger. That's where your fingers get stuck as they open up, so I had some surgery. And you've got something on your hand.
Yeah, you can sign mine. Mine's a fiberglass
fall.
one.
You had a fall. Now, it's really important. Falls are a big problem. In Dane County last year, more people died from falls than died from murder and suicide combined. So falls are really important to try to prevent. And, you know, it's still slippery out there.
Yeah, all right. And I had the flu last week.
Right.
Influenza B. I went to the doctor. It was a positive result, and I got the shot.
That's right. Well, you know, you can get the shot. You'll still get it because sometimes the shot is not totally effective, but it'll be a lower case. We still recommend people get shots because it's important to keep that down. And there are a lot of other viruses. But, you know, one of the other things is if you got if your doctor then took a swab to see if you had influenza, the swabs don't always tell you if you have it. So if you have a high fever like you have, got to see your doctor and got to get checked.
But if you got the flu shot, it did protect you from influenza.
It did protect you from getting even, and it does protect you, and your case won't be nearly as bad.
Yeah, I was sick, but, you know, 3 or 4 days. It wasn't like a good...
Yeah, it isn't like 2 weeks.
Right.
That's
and they put it on the
Tamiflu. That's exactly right.
So that really helps. All right, we have some calls here. Let's start with Chad in Portage. Hi, Chad.
Good afternoon, guys. How you doing?
Okay, what's your question?
My question is it possible for your thyroid to correct itself? 2 years ago, I was diagnosed with hypothyroidism, put on 125 micrograms of levothyroxine, and I'm just wondering if through diet or any other means, is it possible for the thyroid to correct itself?
Good question.
Well, if it's true hypothyroidism, the answer is no. You know, usually it's going to be that way for the rest of your life, and you're taking thyroid replacement. It's just like a diabetic taking insulin. Now, the important thing about this is sometimes people will have sort of borderline hypothyroidism, and sometimes if you take a repeat test, you don't really have low thyroid. So for those people, it did correct itself because the test was wrong. In other words, one test doesn't make it. But if you're on 125 mics of levothyroxine, sounds like you pretty much have it, and you have to take that medicine for the rest of your life. It's replacement.
Stay on the meds.
You bet.
All right.
All right, let's go to Don in DeForest. Hi, Don. What's your question?
Yeah, I got a question for Dr. Zorba Paster. Restless legs. What can you take to get rid of it?
Sure. Restless legs, big problem, especially when you're trying to go to sleep and your legs are moving all around. The best drugs are drugs that are actually used for Parkinsonism. The drugs we use for Parkinson's disease are very effective for restless leg syndrome, and I highly recommend it. We used to give quinine, but then in double-blind studies it was showed that that old treatment of quinine really didn't work. But the anti-Parkinson drugs really work, very effective, and I'd recommend you try them.
Okay,
Need a prescription, of course.
All right, let's go to Barb up in Sun Prairie. Hi, Barb.
Hi.
Hi, what's your question?
My question is, if you have calcium, after I had a blood test, the calcium in your blood, does that have something to do with parathyroid?
Well, calcium, parathyroid is a parathyroid hormone in the body is useful and very important for calcium metabolism. And part of the diagnosis is if the calcium is abnormal, and often we repeat that test to see. And then we also check actual parathyroid hormones. So it's important if you have that you get it double checked.
All right.
All right, let's go to Julie in Madison. Hi, Julie. What's your question?
Hi. My question is, do expectant mothers still have to be very cautious around children with measles?
If you have had measles, you don't have to worry because you actually have immunity to measles. If you don't know if you've had measles, that can be checked with a blood test from your doctor. And of course, many people certainly were immunized for measles years ago. The measles vaccine, MMR, measles, mumps, German measles, has been around. That vaccine's been around for about 40 years. One of the things we check for is German measles, which is rubella, and that's checked routinely for a mother when an expectant mother actually is pregnant to make sure that you're actually immune to that, and if not, it's very important to get treatment.
We thought measles were eradicated.
Well, measles was eradicated until we had a bunch of people who said, wait, I'm worried about the measles vaccine. It's going to cause autism, even though it's been proven not to cause autism. And the guy who goes around from England who keeps on lecturing about it gets $10,000 a lecture to talk about something that is scientifically untrue. Get immunized. All your children need full immunization to keep them healthy. Very important.
Don't fall off your soapbox. Kathy in Platteville. Kathy, go ahead. Kathy, you there?
Hi. I have a Baker cyst on the back of my leg, 4 years ago, I had a torn MCL, and that kind of corrected itself. Now I have a Baker cyst on the back of that same knee.
Right. We don't usually do surgery for that. That's where there's fluid in the back of the knee. Often it's physical therapy to get that knee nice and strong. That's the important thing to do. And then hopefully the cyst will get better. Sometimes there's surgery, but most of the time it'll get better by itself with physical therapy.
All right. Great questions, everyone.
Yeah,
Thanks for calling
Thank you for calling today.
You get better. You get better.
Thank you.
I'm getting better.
And you get better. We'll all get better.
We'll be right back with a final check of your forecast.